Hello and welcome to Health and Wellness, your guide to the integrated personal and financial retirement journey for physicians. I'm your host, Michael Swartz, Certified Financial Planner and Master Certified Physician Development Coach. Welcome back to the Health and Wellness Podcast. My guest today is Dr. Daren Tobert. He retired in September of 2024 from a position in sleep medicine at Gundersen Medical Center in La Crosse, Wisconsin, which is now Amplify. But he started his career in pulmonary and critical care, and this did have some influence on his retirement journey. And today we're going to talk about preparations, career, and the entirety of the career arc all the way up to and through retirement. So with that, Daren, welcome to the podcast.
Thank you, Michael. Thanks for having me.
Absolutely. So, if you could, Daren, start us out here in pulmonary and critical care, kind of the start of your career, and maybe just tell us a little bit about that arc of your time in medicine.
Mhm. I trained in pulmonary and critical care ultimately after internal medicine residency. I did a fellowship in pulmonary and critical care at Mayo Clinic in the 90s and entered practice in 1996. Um, Really back then, what drew me to pulmonary and critical care was just, the adrenaline of it. Very, very cool specialty, high tech, very acute, very life and death type decisions. And I always felt like I took a lot of pride in being the doctor that could handle anything coming in the door kind of thing. And of course, back then we would work, very long hours, very crazy shifts. And so that's kind of what drew me to that specialty. As part of that, we trained in sleep medicine. Back then, sleep medicine was not really a specialty yet. It didn't have its own board certification. So most pulmonologists trained at least part-time in sleep medicine and then practiced sleep medicine in a full pulmonary practice. And so that becomes important later in my story when we talk about how my career evolved. But I entered practice in 1996. We started out in Iowa at an underserved medical center. My wife and I were immigrating from Canada. So we did J1 visa jobs in Iowa we actually stayed 6 years. The requirement was 3, but we enjoyed our time there. And then started to creep in with some burnout. I was, working crazy hours, home every evening at 8 p.m. and up early and out before the kids were up even. And that was just not sustainable. So we moved our practices to La Crosse in 2002. As my career involved, I did suffer through burnout and, all the classic symptoms of burnout that people know these days. And I've learned since that this is really not an uncommon phenomenon in critical care, especially back then. They've made some real improvements in the practice of critical care now, which really have helped. But suffered through burnout. And I coped with that by gradually modifying my career. I emphasized sleep more. When sleep became a specialty in 2007, I grandfathered into the exam right away and became board certified in sleep. And then over time, my career just ended up in full-time sleep medicine for about the last 5 or 6 years of my career. The other thing that helped enormously with burnout was to drop my FTE from 1.0 down to 0.8. Just that one day off per week made an enormous difference to my mental health. A full day off where I could make appointments to do things that had to be done during business hours. I could golf in the afternoons in the summertime on those days. And it was just enormously helpful to have that little bit of extra time. And while that does lower salary and delay retirement to some degree, it made me a much happier person and just more probably effective in my job because I wasn't always constantly feeling stressed. And then getting rid of call, of course, with transitioning to sleep medicine, really no nights, no weekends, no holidays. all clinic time. So having that fixed schedule where I can see a list of patients, I work my way through it, and then I can go. That was enormously helpful for my mental health too. So yeah, I would just throw that out to folks that might be struggling with some burnout. Uh, by all means, cut back. You don't have to go, balls to the wall all the time. You can kind of cut back, work at a sustainable pace, and it'll likely help mental health. So that's kind of my career journey. Came to retire in 2024. We knew we were getting close, and we really looked at things carefully in March. And my wife pulled the trigger in April, and I worked through the summer because I'd promised my partner that I would cover him for vacations. But otherwise, I had a fair amount of time off during the summer, and then wound it up in September.
Wonderful. Well, there's a lot to talk about just right there, the career arc, and we call it the dirty B, the burnout piece, and that such a challenging piece to overcome. But it sounds like you were able to handle that mid-career, and I'm just curious as we tie that into kind of the retirement theme, as it was leading to maybe mid-career or near the end of your career. How did that change your perspective on retirement, and maybe more specifically, kind of that integration between role and identity for you?
Hmm. Yeah, well, a lot of physicians, I think, do get kind of their identity tied in with their work. Um, I never saw it that way. I kind of always came at medicine from an interest standpoint. I probably enjoyed learning medicine more than I enjoyed practicing it ultimately. But some of us, are just attracted to medicine because it's a really cool science career that you can have. In high school, I was enamored with science. Actually, from the time I was a little boy, I was reading, first grade level science books and just always enthralled with science. And so when it came to starting university, I just felt that pre-med was a fantastic broad overview of science, and ended up going into, and of course I loved being a competitive person. I loved the challenge of getting into medical school. So I would work to get those top grades, and then was accepted to medical school. So I kind of came at medicine from that angle. I joked right up until I retired that when people ask me what made me want to be a physician, I would often say, I'm not sure I do want to be a physician yet. Right. But so I think, to get back to your question, that kind of arc helped me. I never really identified, like, I don't consider myself as a physician in the priesthood type sense. And so, as soon as I retired, I now write my salutation as Mr. Daren Tobert. I don't get a big thrill out of being called doctor anymore, even though I could technically use the title. So for me, it was always just about a job and about a career. And that was always great. I loved medicine for that. It was an awesome career, one where I could learn something new every single day and from every single patient. Even in sleep medicine, where it's largely dealing with sleep apnea, there are always little nuances and enhancements to the science going on the margins that you can dig into and still learn and be productive every day. So I guess that's how that kind of wound up for me.
Yeah, I love that. And, near the end of the conversation here, maybe in a second interview, we can talk more about maybe the lack of integration and how that healthy relationship with your career really made a lot more objective decision for when you were going to retire. So a little bit of foreshadowing there, but I do want to touch on, you mentioned your wife, and Sue McClellan Tobert was actually one of the guests on this show very recently as well. And so
Mhm.
um, just as a dual physician household and maybe some of the dynamics there, what were the conversations that you and she were having, and how did that partnership help with your careers and with this transition into retirement?
Yeah, yeah, that's a great point. Well, there are many, many physician couples out there. I think the stats are something like a quarter of all physicians are married to another physician. It might even be higher than that now. Sue and I are quite unusual. We're high school sweethearts. We met when she was 15, I was 16 when we met, and we've pretty much been together ever since. So 37 plus years of marriage, and So how did that play out through our career? Well, we attended most of our pre-med classes in the same university, sitting side by side in the classes. We were obvious study partners. We commuted to university together. I would pick her up every morning. And, we kind of just matched our careers all along. We got into the same medical school. After medical school, we did a general internship at the same hospital. Following that, we both got residencies at the same institution, kind of, a little bit outside the match back in those days. And we paired immigration to a different country along with that together. And then we did residencies of the same length and fellowships of the same length. So all along the way, we entered practice the same year. There was never any long distance component to our relationship. So how did that help? I mean, to have a life partner to that degree is just enormously supporting, and that relationship is just so nurturing and caring. Of course, when we were struggling with the rigors of 1 in 3 overnight call, our partner was too, and so we kind of had a deep understanding of the other person's struggle and could provide support in that way. We would give each other a wide berth for rest and recuperation because we both knew the need, and so yeah, I think that's kind of a unique part of my story. I don't know that there's too many other physicians that would have that level of partnership throughout their lives, but that's just been the dominating feature of my career and coping with rigors of a medical career. It was interesting at times, of course, with two busy physicians. There were times where I was, inserting a line or dealing with a critical patient in the ICU. At the same time, my wife is a pediatric cardiologist. She'd be called in to do an echo in the NICU. And so the kids would come along with her. The nurses would kind of look after the kids in the break room, kind of a thing. And so it was far from ideal at times. Talking to our kids now, they don't really know any different. So they didn't realize that that was unusual or weird. And so it was just life for them. But yeah, I think I can't tell you how much Sue has meant to my life and career. It's just it goes way too deep to explain.
Yeah, and maybe just to tease one of the details out of that, Sue shared it in our conversation too, but as a physician development coach herself with some advanced designations, maybe it's the old adage, the painter's house is the only house that actually needs to be painted. And maybe she didn't do a lot of coaching with you, but even have a life companion. I guess I don't want to tell your story for you, but oftentimes having, for you to have a life companion and partner in crime, so to speak, who's
Mhm.
also, focused on kind of the coaching and maybe supportive elements of being a physician. Did you
Mhm.
have any experiences with Sue coaching you, even indirectly, or was that something that
Well,
stayed
she's
outside?
she's tried. She's tried. Um, I always joke with her that she's welcome to try, but my burnout goes pretty deep. And I
Okay.
mean, I think that it's not too much to say that there are elements of PTSD
Okay.
in my story. I mean, the problem goes deep, and it was there for a long time, and ultimately it was very difficult. Sue's coaching career has been awesome. It's really given her a spark, but it's really just the last 10 years she's been into that. And so
Awesome.
remember, we had 30 plus years before that. So she's tried to coach me. I would say I've been somewhat resistant to go off in that direction, if you will. Whereas our old coping mechanisms of just hunker down, tough it out, gut it out, kind of thing. That was our coping for a long, long time with each other, and we would support each other in that. But we didn't really have another paradigm through which to look at burnout.
No,
And
that
so,
totally
yeah,
fair.
she's an awesome coach, and she did just get another designation here recently with her big exam. I'm sure you know about it.
Oh yeah, we
The
talked through that, the
Yeah,
MCC, correct?
yeah. She's
Awesome.
very excited to get that designation too. So
Awesome.
she's having a lot of fun with her coaching career. Yeah.
Well, as we look kind of then towards the end of your career, you mentioned, Sue retires earlier in the year. You've got some
Mhm.
objectives to take care of and promises and commitments to follow through on. But as you guys are looking Now, at the end of your career, you're on the other side of the burnout. You've found this niche in sleep that the schedule's working for you, and you get your feet back underneath you. You're growing around a new form. As you start approaching retirement, what's going through your mind in terms of wrapping up this career? What reflections did you have, and what did you do to prepare for this transition?
hmm So I think big part of that was just looking at the money aspect of it and the financial part. We've had a few conversations through our time together, Michael, about finances and getting to a number that you know you can be very sure of and confident that you'll be okay with. So that was a big part of it. I've been finance focused for many years. One of those unusual maybe 3% of people who tracks every expenditure to the penny in financial software. That's a very unusual thing, but I've done it for 30 plus years. And so that was a big part of just looking at retirement. And like I say, well, I loved sleep medicine, and I really did feel that had I needed to continue working, that I was at a very sustainable level of practice and life management where I felt I could easily continue another 5 years. But the need to work just wasn't there. Using financial planning software, we looked at the effects of stopping now versus working and adding to our portfolio another couple of years, and it just was amazing how little difference it made to the final outcome. So at that point, we really kind of realized that we were okay to be done from a financial standpoint. From a social standpoint, and just thinking about the uh, down ramping of work. We were ready. We talked for many years about aiming for retiring before 60, was a big goal of ours all along from the time we were kids. And so we were there. I'm turning 60 this year. So we just made it by about a half a year. But, um, you know, uh, people often ask, what are you planning to do in retirement? And I just say whatever I want. I think we were drawn by the idea of the freedom. For years and years, we've been interested in being able to travel more. We certainly have that ability now. And so that was a big bucket list thing for us, was to get out there and see the world a lot more. So we've been able to do that already in the first few months here. We've got some major trips planned for the next couple of years. So, um, yeah, I don't know if that answers your question, but that was kind of where we looked at it. And the other thing I would say too is we got to the point in our planning where we wanted Sue to retire first, and there's several reasons for that. But we were looking at her schedule and the way it worked with her call and so on, and we were trying to map out, okay, let's use up all your vacation and sabbatical time that she had built up. And there were some months where she was only able to really use 3 or 4 days of her time, and then we were mapping it out. We got to October of 24, where a new set of vacation kicks in, and then we have to go more months. And it just became ridiculous. We were out into the middle of 2025 before she'd be able to even use all her accumulated free time. And so we just said, let's look at a different paradigm. We'll just release that, let it go, and look at a 3 week notice. And she ended up doing that. So yeah, that's kind of how it looked at it. It was a little bit shocking at the end to just say, hey, we're here, we're done. But that's kind of how it worked out.
Yeah, and one thing that we talk about is just that arc of preparation. And, most retired physicians shared, between 2 to 10 years to really start thinking about retiring, to start doing the math, to start building this framework for retirement. And it really sounds like at least in the book, I talk about, well, if you're just thinking about retiring on the day you start working, that doesn't count, right? It's an active role in this process of retiring. And yet, from the sounds of it, you guys really were actively working towards this retirement before 60 for most of your career, with a lot of these conversations occurring throughout the course of your career.
Mhm.
You've got this burnout and kind of restructuring of professional role within the organization. You, and I don't want to tell your story for you again, but you've got really this healthy relationship between, your identity and your career, which
Mhm.
really provided both you and Sue the freedom to say, hey, if we've got this coaching thing to retire to, and I've got this really wonderful life outside of work that I'd like to get back to, it's already there
Mhm.
waiting for you. That freedom in retirement doesn't take this whole regeneration of values, purpose, identity inside yourself. Those have been there all
Mhm.
along. They really hadn't been infringed on or forsaken for your career
Mhm.
post burnout. Is that
Right,
fair?
right. Yeah, it is fair. I would say that my identity was always outside of the medical center. It always was. I saw myself as a dad and a husband and a golfer and a, hockey referee, and that was me. And then this is what I did for a paycheck. And I enjoyed helping people with their sleep problems and, pulmonary problems and so on. And that was a cool way to earn a paycheck.
Yeah.
But that's where I was. And I know other physicians see themselves as Dr. X or Dr. Y, and that's who they are. Much different process for that person to transition to retirement. And a lot of colleagues would, just really say, I'm not planning on retiring. I'm going to work till I'm 70 at least, kind of thing. And they obviously could retire earlier, but literally they just do have that as their identity. That wasn't ours. I think the other thing about the whole connection to finances was that there were a few profound uh, aha moments or eureka type moments for me along the way. One was just, early in residency, I became interested in personal finance, and I've read hundreds to thousands of books on this topic, and that gave me the confidence to, begin saving early. Like from the moment I had a tax deferred retirement plan available, it was maxed out for both Sue and I, starting at age whatever, 24, whenever we started to earn resident salaries and had access to a 403B, right? And even before that, we were maxing out IRAs with our side income or whatever. And so, and then, along the way, I ran into a blog in the fire space, financial independence, retire early
Yeah.
space, right? Mr. Money Mustache, the shockingly simple math behind early retirement. And he basically lays out that if you can get your expenses down and your savings up, you can retire in an enormously short period of time. And that probably hit, I don't know when that was published, but it was probably about 15 years ago. When I read that, it was just, yeah, holy mackerel, we can be done very quickly if we just really focus down and bear in on this. So, if there's any learnings along the way, just I would say for young physicians, make early retirement an option for yourself. And if you love working, you can keep working. There's
Yeah.
no problem that. But it's nice to have the option to be able to retire early. So take a look at the numbers. If you've got debt, pay it off immediately or as quick as you can. And by all means, start chunking money into retirement accounts early. Your biggest asset is time. So,
Awesome.
yeah,
Yeah, I think, ballpark numbers here. The figure is for every dollar saved at the start of your career, if you work 35 years, it's something to the tune of $14, even corrected for inflation, right?
right.
Human beings
Mhm.
just, it's not intuitive to understand what compounding exponential growth truly is. And
You're
so
right.
for you
Yep.
guys, you started doing this very early on and obviously reap the benefits of that later on. And so once you've got this financial freedom, which is where most people start looking at the retirement problem, is they think it's just a financial problem. Comprehensive retirement planning is financial retirement planning. And the answer is, well, there's a personal element to it too. And
Mhm.
and so, you walk through these financial elements very early on, a lot of foresight, which allows you to really look at this a lot more objectively through the personal lens. And so a bit of the best of both worlds and compliments to you for taking that on and upon yourself very early in your career. So phenomenal
Yeah.
advice.
Mhm. Oh, good. Yeah. I mean, it's just it having money gives you optionality. It just gives
Yeah.
you freedom. And maybe it was that, you know, part of my keeping work and self separate throughout my career. Part of that was just maybe I'm an investor as part of my outside of work thing. I'm a financial guy. That's my identity, maybe. Helping to keep that work and and life separate, not wrap them up together. Um, so maybe that's part of what made the transition to retirement easier for me, is I felt like those were different things.
Yeah, and quite powerful. And so I think, the Health and Wellness podcast really focuses on physicians and what they can do to prepare for the retirement journey if they don't know. But what I'm sensing as a theme out of our conversation today is not everyone's going to face this really challenging mountain to overcome, a massive decoupling of career and identity. And if that's you, don't create a problem if there isn't one there in the first place. If it's not broke, don't fix it. If there's this internal sense that you've got this covered. Um, I'll share, you attended the Honoring Onward sessions, and
Mhm,
that's that group program, that group retirement coaching that we have here at Gunderson as well. And
mhm.
really, it was almost as if you came into the group and offered a bit of reassurance for those that were more unsure, to say, no, once you have this in place, the personal transition actually isn't as challenging. So if the finance is taken care of and the personal's done, let's call it good and let's make it happen. And so
Yeah,
that was really empowering.
yeah, I really enjoyed the Honoring Onward sessions because they really, even in our little group of six couples, seven couples, there was a wide spectrum. There were
Yeah.
doctors there that I would say, were fully doctors. They had no grid for retirement. They had not thought about it. And that opened my eyes to a different way. But yeah, Sue and I kind of came to the program pretty much ready to go. So there is a spectrum out there for sure. So if you're like me, if you've got your identity pat down outside of medicine, I think like you said, it makes it a little easier to transition.
Yeah, and being, I'll speak from the perspective of other physicians that have been on the podcast. It's a problem solution mindset, a dichotomous black and white. And oftentimes your role is to first figure out, diagnose what the problem is. And so the mind is really conditioned for physicians to seek out the problems. And again, just that reassurance piece that if it is put in place and you are ready to go, don't take this as a warning that you're missing something. Just use it as an opportunity to make it a conscious choice to say, nope, I checked that. It is good to go. Let's go make it happen. And so I
Mhm.
think with that, Daren, we'll wrap up our first of two conversations here. I appreciate you sharing about your career. Not diving too deep into the burnout piece, but bringing that out into the open as well. And
Mhm.
then talking a lot about this early retirement and what your relationship with your career and your finances allowed you to do with retirement before 60. That's a big
Yeah.
congratulations.
Thank you very much. No, it's been a pleasure chatting with you, and I look forward to our follow-up.
All right. Thank you, Daren.
Okay. Bye-bye.
Thank you for listening to this week's episode of the Health and Wellness Podcast. As always, I'm your host, Michael Swartz, Certified Financial Planner and Master Certified Physician Development Coach. If you're looking for additional resources for integrated physician retirement planning, please visit healthandwellness.com. We'll see you in the next episode.